Well, meantime, America's top pediatric group making a huge move to eliminate race-based medicine. For years, these guidelines have led to health disparities and misdiagnoses. The American Academy of Pediatrics says it is now putting all of its guidance under the microscope. And just last year, the organization retired a guideline that claimed black children faced lower risks of urinary tract infections than white children, after a review found the strongest factors had nothing to do with race. So joining me now, Dr. Anthony Harris with HFit Health. Dr. Harris, thank you so much for being with us.
Thank you so much, Nichole.
All right, so pediatricians have been following these race-based guidelines for years. Talk about how they have potentially created disparities in healthcare.
Sure. And so if you want to characterize how serious racism in healthcare can be and the impact of it, you need to look no further than the CDC and what they've said. And I quote, racism is an imminent threat, serious threat to public health. Right. And so when we talk about racism in the context of healthcare, I mean, we got to go back 400 years to the construct of racism that obviously subjugated a population of individuals based upon their skin color. And so as medicine has developed over time, we have unfortunately used racism or race, as a proxy for biologic impact. And that is not true if we look at the data today. And so that is what the AAP is getting after, trying to eliminate those policies, those clinical decision-making things that have been in place for decades, and updating them so that we can give better care to a disadvantaged population.
You know, Dr. Harris, I saw this, and you got into this a little bit, I think, in what you just said. But, you know, why was there race-based medicine in the first place? You know, in 2022, we hear that, we just think, what?
Sure. I mean, you know, it's not as far-fetched, perhaps, as, you know, one may think it to be, right? So we know that there are true genetic differences in regards to outcomes for various populations, Ashkenazi Jews, African Americans, in regards to certain underlying disease and illness. That's the genetic underlying. But the fallacy, the poor science comes when we try to use race, color of your skin, simply to draw conclusions for biologic outcomes. And that is what has been in place. That's what AAPs are trying to eliminate. And so, again, it's just updating to the latest best practices, and that's away from race used as a determinant.
Well, you know, doctor, talk to us about some of the diseases, some of the conditions that have affected black children because of these guidelines.
You bet. You mentioned one earlier and presented it, UTIs, right? If we look at UTIs amongst children, and in particular, the study that began this back several years ago, right, looked at and talked about UTIs for 2-month-old up to 24-month-old children. And the premise of this paper was based on that black children had less likelihood for urinary tract infections. And in the paper itself, it speaks to that premise needing more research to actually draw conclusions around whether or not that's actually true around black children not being at risk. And so treatment guidelines were based upon this paper. This paper was actually cited 953 times. And so it was prolific in regards to how we treat UTIs amongst these population of children. And it's been poor practice and it's harmed children. And so now we're trying to change that.
Yes, certainly time for change. Dr. Anthony Harris, thank you so much for your time. We appreciate it.
Thank you so much, Nichole.
Thank you for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.